Today's protest and the anger of the people of Roscommon have brought this issue to a head, and there has been mounting evidence of a crisis in the A&Es. That has persisted for many years, and it will not be solved by subjecting the health services to more cutbacks. Research published late last year found that only 13 of the 31 emergency departments around the state were properly staffed. That was because vacancies had not been filled, with enormous pressure on junior doctors to fill that gap, with many of them working long hours, which endangered both their health and health of the doctors, the patients, and everybody they had to deal with. While guarantees have been given that the A&E at Kerry General Hospital would be secure, the emergency department in the hospital, according to that survey, had the second highest vacancy rate in the state of 66%. Failure to fill necessary posts is imposing massive pressure on staff and obviously impacts on the level of care given to the patients. And this is replicated right across the state. The report by the Irish Association for Emergency Medicine criticised the dependence on junior doctors to staff accidents and emergency wards, and stated that full-time staff needed to be appointed in order to ensure that the system operates efficiently. Instead, what we are now seeing is a programme of further cuts which will further impact on A&Es across the state, and indeed we have seen is largely leading to closures. Of course, the cuts in the health service do not only impact on A&Es. For example, it is now common practice in Kerry General Hospital to discharge patients at the weekends in order to free up beds. Staff are being forced to do this in order to cope with the pressure that they are being put under. But patients who are discharged in that way often had to be readmitted. I personally know of one person that was discharged on a Friday, was readmitted on a Sunday and died on a Monday. That is fact. The man was terminally ill, but I know that is the case. It is not the fault of the staff concerned who are working under enormous constraints. And of course there's a lot more involved than simply the financial aspects of it. However, one thing is certain, and that is that closures or making cuts as part of a money-saving exercise is not going to provide the solution to the crisis. The biggest problem with the A&Es, as in Kerry and other locations, is that the lack of beds prolongs people's wait to be seen to. As of June the 29th, there are 29 surgical beds closed. That means that people in severe discomfort often have to spend long hours waiting to be seen. I have one report of a woman who was waiting almost 36 hours in the A&E department before getting a bed. The continual failure to open that much-needed Tralee Community Hospital is a huge issue locally. Imagine spending millions upon millions to build a community hospital and it's currently lying idle. 1 minute remaining, Deputy. Okay. In Limerick, there are a lot of concerns around the future of accident emergency services in the Midwestern Regional Hospital, which is feared may have to be curtailed from next week due to the shortage of doctors. The chairperson of the hospital board has said that he fears that patients may have to be sent to Cork or Galway, as the hospital may not be able to ensure full cover during the night. What both brought this crisis here tonight, I want to commend the people of Roscommon, of Portlaoise and the surrounding areas, who came here in their hundreds in the pouring rain to show that they were not going to stand and allow this to happen to them. They are prepared to fight back, and I commend them for it. And what we need to see right across the state is people who are having their rights taken from them, who have emergency wards closing down, who have sick people on trolley beds, need to come out and stand and tell this government and tell the Labour Party, who were so loud in opposition about what was happening with the previous government. Tell them this is not on. We are not going to tolerate it. We are going to fight back, and the government want to start listening.